Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, it's joining us our online affiliates around the world, including iHeartRadio and Amazon Music Podcasts. We're glad you all could be with us, too. Well, we've all probably heard on the news about the Great Resignation affecting different industries, but unfortunately, it's also impacting the healthcare industry. And while we're in the middle of a pandemic, the healthcare crisis definitely is a reason why so many nurses seem to be leaving their jobs, citing both the heavy workloads, but also the exhaustion that can come both physically and emotionally. Well, what can we do to be able to make sure that the nurses are being taken care of, as well as inspire future nurses to be able to enter the profession? We're excited to welcome Kathleen Belmonte to our program today. She's going to talk with us not only about what she has been able to see when it comes to nursing, but also what we can all learn about the importance of the job they do and what can help them to make sure that they're feeling taken care of. Kathleen, thank you so much for the time. Really appreciate it.
It's great to be here, Cyrus. Thanks for having me. I'm really happy to be partnering with the nonprofit Women in Government Foundation to work and try to solve the nation's nursing shortage.
Well, Kathleen, this is something here in my home state of Mississippi, unfortunately, we have been hearing about here locally, but it is something nationally that's going on. What is it that you have been able to hear, Kathleen, when it comes to what nurses have been facing over the past couple of years?
Yeah, thank you, Cyrus. So as you know, nurses are the backbone of the healthcare delivery system, and they have truly been the heroes throughout this entire pandemic. They continue to provide clinical care under tremendous pressure to sick and dying patients throughout this pandemic. And while the pandemic has caused this devastating loss of life and strained incredibly the health system, it's also brought into focus the amazingly pivotal role that nurses play in healthcare, particularly frontline nurses caring for our patients. And what are they telling us? It's like you said earlier, our nurses are telling us they feel stressed, they're exhausted, they're burnt out. And a consequence of burnout is nurses leaving the field in the midst of what is already a nursing shortage situation.
It really is sad to be able to hear, especially considering everything that they've been doing for us, Kathleen. I should mention you're also the Vice President of Clinical Services for Fresenius Kidney Care, so your primary work is in kidney care and dialysis. What type of challenges have you and your industry experienced through the pandemic?
Yeah, Cyrus, thank you. So at Fresenius Kidney Care, just to set the stage, we service probably about 200,000 patients with kidney failure across the country, and we employ roughly 20,000 nurses to provide life-sustaining dialysis treatment to our patients. And so the COVID-19 pandemic has been really, really difficult. It's been difficult for our patients. It's been difficult for our caregivers. And from our patients' perspective, it's difficult because patients with kidney failure are at a much higher risk for severe illness and possibly death if they do contract COVID-19. And so that meant early in the pandemic, we put a lot around infection prevention, around screening, around testing, providing personal protective equipment to nurses and patients. And we believe that this has been instrumental in not only protecting our patients, but also our nurses. We've been very diligent at establishing early isolation shifts and isolation centers so that we can keep our patients who are infected with COVID out of the general population to avoid spread of illness, but also to help relieve the burden on hospitals. We have acute programs that nurses staff that we know are overburdened. And so we wanted to make sure that we could provide support in the community as well as the hospital setting.
Such important work, and again, we appreciate the work that you all are doing. Kathleen, I mentioned the Great Resignation is something we've been hearing about, as I mentioned, here locally in Mississippi, but also I know for our radio audience joining us around the country. Unfortunately, there are nurses that are leaving the industry because of some of the factors we've talked about. How can companies support nurses, Kathleen, who may be looking for a new career path?
Yeah, so Cyrus, from my perspective, there's a couple things. So in Jackson, Mississippi, where you are, we definitely have a nursing shortage. And so we are talking to lots of people about nursing as a career attracting nursing talent, retaining nursing talent. So from a nursing perspective, we know it was important early in the pandemic, for example, that we wanted to make sure that we had emergency pay and child care and elder care stipends in place to support our nurses who we were asking to remain frontline during the early phases of the pandemic and even now, making sure we could provide care to our patients. Now, as the pandemic has moved on and we're now nearly 2 years into this, we've pivoted a little bit to try to create more robust compensation packages. Compensation is one piece of that, but I think we want to make sure that we are supporting development of wellness programs, right? The stress and the burnout is difficult. So from a nursing perspective, we need more nurses. We need to support the nurses we have. And so focusing on their physical and emotional well-being is very, very important. And so think about things like balancing work and life, building resilience in our frontline nursing workforce, supporting their healthy person. So supporting mental health, and mental health is being equally important as physical health. And we've started to make wellness programs available to help our nurses manage the stress and find balance. So we want to keep our nurses. We want to encourage more people to come into the nursing field. But it's important that we recognize where they are and be able to provide programs that provide support to them.
Amazing. Last thing I want to ask you about, Kathleen, again, I appreciate this time, is the Nursing Licensure Compact. It's been one of those things that's been able to really help you guys. Talk to us about what it's doing to be able to address the nursing shortage.
Yes, this is incredibly important. So the Nursing Licensure Compact, Cyrus, has actually been around for over 20 years. And right now there are 39 states that participate in the Nurse Licensure Compact. So, for example, Mississippi participates in the Nurse Licensure Compact, but a state like California does not currently participate. And so what is it, and why is it important to nursing staffing shortages? So the compact allows a registered nurse to get a license to temporarily practice in any other state that participates. So, for example, I am board registered in Massachusetts as a nurse. If Mississippi is experiencing a staffing shortage, because Mississippi is a state that has nursing licensure compact, we are able to move someone like me in Massachusetts down to Mississippi for a temporary period of time to provide staffing support to programs in states that have the licensure compact. So when you think about this from a nationwide perspective, it gives us more flexibility to support nursing staffing shortage, bringing resources into states where we know there are markets that need support, where we know there are patients who need care and we don't have available nurses to provide the care. So we are doing a lot of education, working with a lot of states to make sure we're advocating for nurse licensure compact as well.
Kathleen, a lot of great information you've shared with us today. Again, everyone, Kathleen Belmonte has been our guest, the Vice President of Clinical Services for Fresenius Kidney Care, sharing with us information not only about the nursing shortage, but also what can help. Kathleen, where can our audience go for more information?
Yes, so you heard me mention the nonprofit foundation Women in Government. They have put together a really terrific landing page, some great resources on their website that will provide information about nursing licensure compacts and also about the job market for nursing. So head on over to womaningovernment.org. That's woman with an E, ingovernment.org, and you will see that they have some great resources there that can be used to help with education and advocacy efforts.
All right, Kathleen, we'll make sure to link that up for our audience. Thank you so much for the time today. Really appreciate you stopping by.
It has been great, and thank you, Cyrus. I hope you have a great holiday season.
Thank you, you as well. And we thank you, our audience, for tuning in to another great segment of Conversations Live, part of our News You Can Use segment here at WYAD 94.1 FM and WYADonline.com. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.